So these hormonal changes, I really can't emphasize how large they are.
So after a female rodent gets pregnant and she goes through the pregnancy and then she has the pups and she starts doing these maternal care behaviors, can you give us a sense for some of the major hormonal changes that underlie that?
So it's probably the two biggest hormones that we think about when we think about hormonal changes during pregnancy are estradiol, which would be part of what we would think of maybe more commonly as estrogen. So really, there is no such thing as estrogen. It's estrogens is a class of hormones,
Mhm.
estradiol, estrione, and estriol, but estradiol is really the primary one. And then progesterone is also changing. And progesterone, the hormone progesterone, literally means progestation. So progesterone is climbing throughout pregnancy, as is estradiol. And then around the time of birth, there's just this fallout. Everything just comes sort of crashing down. And actually, the drop in progesterone is really necessary in order for birth to take place, because progesterone is sort of one mechanism, peripherally speaking, is it's sort of in antagonizing oxytocin and preventing an early expulsion of the fetus. And
Hmm.
so you need progesterone to sort of drop out if birth is going to happen. So these hormonal changes, I really can't emphasize how large they are. We sometimes call them super physiological because, we tend to think about like what, in science, what is in the physiological range? And oftentimes when we talk about pregnancy hormones, we call them super physiological because they're changing on a hundredfold
Yeah.
scale.